Hi everyone. So in this video, we are going to discuss most underrated topic in our medical profession. That's patient education. So we always feel that the patients don't know about their body, even though they know something about their body. That's mostly misinformation which they say seen from the Google or social media platforms, some small information. So no one can explain about one problem, one condition in 60 seconds reel. We are getting that reel, we are correlating because I don't know about the body. It was happened to me. For example, I can say someone is uploading the video. If you have a back thigh pain, it's a sciatica, do these stretches means it tells that audience, if you had that kind of pain, that will be a sciatica, you have no problem. But the patient doesn't know the relationship between it, how it feels, the symptoms, sensitivity, specificity, so many things that doesn't know. So they will come to assume that maybe they use the toilet for 1 hour, for 1 month back. That time they may have some numbness sensation, they could have had some pain, they didn't sleep well, they may too much too soon, back pain got, so they may relate it with that video, they may go misbelieve, so many things will happen to them. These are all the things happening in the society. So even a medical profession, we are thinking that educating the patient, is it like you have a tilt in that body, you have a postural imbalance, these muscles are incorrect, these muscles are correct. So telling this patient about the problem itself, not educating the patient, right? So then what is really patient education? What I am trying to see, patient doesn't know about their body, they are coming to us to know what was the problem on me, how can I rectify, how long it takes to cure, and these many things. If they know very clearly, that was the patient education. So if they know very clearly, they can 50% of the treatment was clarity was done in the consultation itself, even though there is severe condition, right? So what is really a patient education? That's what we are going to discuss, and how to do that. So this is a topic of discussion today. So I'll start with a question. As usual, I'll be a mediator to guide. What do you people think? What's the patient education?
First thing, patient education means you have to talk to the patient. First thing. So you have to interact, along with you have to share information. So interaction plus information is actually called as a patient education. So nowadays, if you're seeing one doctor or therapist, patient thinks like they are superior, and doctor also behaves like this. I am superior, like I am going to talk, I am going to explain the condition to you, the do's and don'ts, everything. Mostly they won't listen to the patient, they won't allow them to talk. So only they'll talk to the reports or anything, then simply they'll explain the condition, and this is how you have to do's and don'ts, they'll tell. But this is not a kind of treatment or explaining to the patient. So patient education is you have to interact, and you have to share information to the patient, and you have to understand. So interaction along with information plus understanding, that is what I
Kind of
feel.
two-way communication.
Kind of
It's
two-way
yes.
communication. So one important part which is shared, that listening to the patient. So listening to the patients also comes under the patient education, which means if you go and say to this audience, who are seeing this medical profession or any other physiotherapist, they will feel that I'm listening to the patient very well, because usually physiotherapists are the person listen to all the story concerns what all the things are patient telling to us, no? So when we are in a position to give a clarity that what is listening to the patient story, whatever they are telling, and how listening should be better, what is actually listening to the patient actually. Because if you say na, everyone watching this video, they will think I'm already listening to the patient very well. So what is listening then? Okay.
Listening doesn't mean we have to listen to all the stories and concerns the patient is telling to us. Yes, we have to listen to it, but we should know where to stop and what to listen. Like, what are the informations we are gathering from the listening part?
Exactly.
So, if it is going beyond the point where unnecessary informations are being gained, it is not going to helpful for a diagnostic process or the treatment process. So listening involves listening carefully to the very informative things which will be helpful for diagnosis or treatment, which are going to be like what we can do to help the patient with that.
So also some patients psychosocially which is affected so much, their concerns listening helps
Yeah.
during the treatment, but you should not only focus on the listening, also you have to encourage the quality of life and other stuffs and everything. So listening means you are going treating a patient and listening for a hour and coming back is not only the listening.
What I feel is in listening, we can come to a conclusion: are they psychosocially affected, or they are only biomechanically affected? Because some people tend to overtell their story starting from how it started, and they keep on going. So in that scenarios, we must know how to stop it. We must ask open-ended or close-ended questions. From the story itself, we should stop them. For example, if they are coming and start narrating the entire story, but there is a particular point where which we feel this is enough, and they are having some shoulder pain or knee pain, so we need to have that symptoms.
We have to go with the specific question. For
Yeah,
example,
specific.
like load management when
Yeah.
you slept. For example, shoulder pain, same badminton player
Yeah.
come or any lifters, any persons who lifted the weight and come with a fear or something also. How much you lifted, when you lifted,
Exactly.
how much volume you are using, how many days per week you are doing playing. These kind of specific questions give a right answer
Yeah.
instead of they are speaking,
Yeah.
speaking.
Exactly, and those who don't speak also, we need to listen. Then how can we
Exactly.
listen to them?
Mm.
In that scenarios, what we need to do is ask open-ended questions. How it started.
Exactly. Always it's like listening means if you can able to correct that part, listening could be good. If that part is useful for the treatment process or the rehab process, listen could be good. Until unnecessary information listening, sometimes it good, depends on the patient nature and narrative feeling, satisfaction feeling. But mostly try to don't waste time, listen to the right thing, and go ahead with an educational part. And listening to the patient itself tells us the what kind of person they are, what kind of character they are, how much worries and fear they are. That's great. So more about the patient education.
And the thing is, there should not be no standardization. Like standardly, we should not keep like these all things have to educate the patient. Like that, each and everyone is different. Each and everyone's concern is different. Each and everyone's field is different. Their life is different. So it is not standardized. So for what they need, we have to pick up and we have to deliver them.
Okay, yeah.
Like our treatment program is tailor made to each patient. Patient education is also a part of treatment, so it should also be personalized. For each patient, it should be different, and as ma'am mentioned,
How it will be different from each patient, can we tell the audience?
For example, if a patient is not so confident, we need to give confidence for them and educate them accordingly. So you can, for example, they are coming with a low back pain, and doctor has advised not to move, and their fear has increased more. We need to educate that's nothing wrong in moving. Even after moving, you can have some amount of pain, which is bearable, means it's good, which will improve your function ability.
Slowly
So
improve your
slow
load tolerance.
exactly. But some patients will come with overconfidence. They will be loading already too much. For example, any athlete or patient with ACL injury, they have some injury, but they have keep on doing overtraining and gym training, which will cause over injury. And in that time, we have to not positively reinforce, negatively we should reinforce, telling that this might cause, if you keep on doing this, this might lead to a surgery.
Excellent.
So that type of reinforcement is needed.
The patient education is very important for patient-centered care. The approach we always using that word. So what is patient-centered approach means already we know that prioritize the patient's needs and their goals and what they want to improve their performance. So exactly about their
Why they
entire
came to us.
yes, exactly. We get a question from with that question. So always we gather the questions like patient-centered approach means we get a questions like we can narrow down the questions. Exactly, we can get the what is their the need and what is their
Directly
value.
we can ask what, for example, I used to do that. 10 patient come with the complaints of shoulder pain. All 10 people will have different goals, as Hema said. So even though the same reason for their pain, so for the pain we can't tell this is the only reason. So considerably most percentage oriented reason, this is a pain reason. I would ask why you are coming to, what is an objective of meeting us, right? So that is called, that is take you to the patient centered care.
Yes.
Great.
So patient education is very very important whenever we want to achieve we improving the patient centered approach. So then only the entire rehab period, right? So it will be benefit for them also, and to us also. Our time also is maybe saved.
And all the therapies and the treatments we are giving will treat the pain and the condition. But patient education is going to treat the patient, the person. Person.
It's not about the pain. Pain it's not about the pain. It's all about the person who attached to
Attached
it.
to it.
That theory. So while treating the pain, the problem gets resolved. The person treatment comes under the patient education. The excellent point. Anyone want to add any more point?
Actually, maybe the words you're talking to the patient, that may not have an impact on the pain or disability, but 100% it will have a strong effect on the person. But it's not, maybe it not show some effect on the body, but it has a strong effect on the person.
Excellent. So I have a question. What words should use? What words should not use?
So again, it comes like each patient, the words will vary.
So, for
actually.
example, say one patient, each patient the words are different. For example, as Vikrant mentioned, one patient is overconfident, going and so much they will do. That's a problem. Then we have to say some negative words. It's not like negative words means saying some wrong things that this is damage, that is damage. If you continue to do it, it will cause more problem. You may end up having not to do it. Negative education and positive education towards the fearful persons. Okay, and also they determined by the problem which they have. So this way understood. Okay, for example, words which I asked, for example, using the word posture in front of the patient, using the word asymmetry, using the word you have a lack of stability. Is there the right words to use to the patient or not? How can we relate it? When to use, when not to use? Should we use or should not use?
Okay.
So when it comes to the uncertainty, certain conditions, we should talk about the uncertainty also. So if the condition may be ankylosing spondylitis, it can't be cured, completely cured, but it should be manageable. So our role is management in that part. So we have to educate about the what is management in this for the particular condition. What are the management you should do? So likewise, we can firstly we have to say, so the thing is not gonna cure completely. So they come to know, but okay, this condition is not gonna cure, but
Any condition with an example?
ankylosing spondylitis.
Ankylosing spondylitis. Oh, you give an example. Sorry, suddenly that's what my ear problem.
So whenever we treating the patients, it's not curable. So we have to say. So it's not gonna
Not
curable. It should be
reversible.
it's not reversible. It should be manageable one.
Manageable. But even though in that certain cases that reverse the ankylosing spondylitis with the consistent effort over the period of time, 5 years, 10 years effort. Even though that inflammatory markers are present, the blood values are reversing, the lifestyle change, everything was happening. Also, certain people we are seeing, right? For example, we know that diabetes type 2 is not reversible and lifestyle disease. That's what we understood, right? So nowadays it's also reversible, right? It's also
Again, it's so much factor in that. They want to listen they want to consistently doing all the exercises, and they might get a good therapist, and also their enough sleep and proper nutrition, and about the family, about financial status, everything plays a major
so
role.
educating this is also plays crucial role. This also comes under the patient education. If you are ready to put effort for next 5-10 years to change your entire lifestyle and behavior, being physically active, you can be sleep wise, everything. Great.
And again, when it comes to words, you main thing is after assessment, you're going to explain the condition. This is what you're having, right?
But
So-
is it possible to diagnose in one condition, one assess session? No, I feel it's too early to say. Her point is perfectly right, but I feel it's too early to say that after one assessment we are going to say. So just we are clarifying that we may come to the most of the time we may come to understanding. Maybe this is a reason for their. Maybe this is a reason for their pain. Okay. Sometimes, honestly speaking, we don't know what was the problem is causing pain. We treated the person, got better. Yes or no?
yes.
So we have to understand that. So in front of the patient, we should not behave like we don't know anything. But we understood something. Oh, this may have a reason, predominant reason for this pain, causing pain. So we are always right. Just keep that in mind. one
At
person.
least we have to narrow down correctly.
Narrow down correctly. Okay. So நீங்க சொல்லிருங்க.
So somehow some condition we can diagnose with one session. Maybe it's a frozen shoulder or osteoarthritis, like that. At least we can
with
able
an
to diagnose.
experience, confident. Perfect.
Yes.
Yes.
So on that time, think like if it is a frozen shoulder means you should not use the term like the diagnosis is adhesive capsulitis.
In front of the patient.
Even though it is a proper diagnostic term, but you should not use. So patient don't know what is mean by adhesive and what is mean by capsulitis. So they'll go and search in the
They will
Google.
think that some big disease is there in my body.
Yes, yes. And it will show some inflammation, it leads to fracture and everything, you can't able to move, like that. It will show lots of negative information in the Google. So they'll get negative feedback, negative thoughts, like that. So we have to say, instead of adhesive capsulitis, just you're having some stiffness in the shoulder.
Just stiffness in the shoulder.
Yeah.
General term.
Yeah.
Using in front
Yes.
of the patient, general type.
Which
So,
term is not in the Google.
not in that. அப்படி பண்ண முடியாது. அது கஷ்டம். அதுக்கு நம்ம இப்படிதான் பேசணும். So what I thought, use appropriate language which they can understand.
Yes, yes. And another thing, you should not use like usually we'll think like we have to explain with a skeleton. Clearly we have to
Most
explain.
of the they have a lumbar spine
Yes.
with disc bulge model. It will ping ping. If you press, it will come out. Easy to convert the patient. Patient fear is increased. They will pay 25 session package. So don't. No, I always feel we should not be in a business model. We are in a healthcare system. We are treating humans. Concerns, worries, everything we have to value.
So
You should not utilize that to earn money.
Yes. So even that is osteoarthritis end stage, but you should not tell like your bone is completely touched to each other. Two bone is completely fixed, fused. These terms you should not use.
Exactly.
So patient get pain to load their joint, stair climbing, everything they'll get pain. Okay, two bone is touching to each other. Every step they'll think like that. So these terms we should not use.
Excellent. And also one clarity, people don't, someone ask, you also earning, right? You also charging this much and all. But for the clarity, we do if it is required. We won't create external fear to do that.
I would like to add on a point.
I don't know. You have all the right to add the point.
So we are treating people who have six senses. So they have imagination. Whenever we are using terms like what she said, they'll imagine. They'll picturize everything. So whenever they are walking, they'll imagine that my bones are moving now. My bones are rubbing to each other. They'll do that.
Excellent point. Excellent point. See, yes, anyone elaborate this.
So that will have a very big impact on their behavior and their beliefs.
Excellent.
As she mentioned, it will change the perception and entire personality of the person. So that,
nowadays it feels like when someone say posture, it feels like bad words to me. Seriously, someone say anti-repellent, don't speak bad words, please. Seriously, it irritate to me.
whenever the patient is hearing such words, why the person is trusting Google? Because they don't have trust on us. So that is why they doubt.
Why they don't have trust on us?
I mean, what I mean to say is, they don't believe us what we are saying exactly. So that is why they go back and Google the terms we are saying. So what we have to do is, we have to reassure the patient that it is completely manageable. This is what going on inside your body, and it is not scary, and you are not too broken to be fixed. That is what we have to assure.
Yeah, again for this, therapists need a confidence.
Yeah, right.
Therapists need a knowledge, confidence. Therapist has to perform regularly exercises. So many things was there. What I am feeling nowadays, even that every physiotherapist have this problem. If they got pain, they have same scare faces, thinking, imagination, what happened because of strong negative belief system from the educational system. If you're learning from posture is wrong. You're learning only through compressing the nerves. You're learning only through these are all the things. That's the problem.
So, like treating a person who is already a physiotherapist is difficult than treating a normal person. That is what you're trying to say.
Sometimes yes, sometimes no. And again, I'm not blaming any of your educational system. If you are educating, you're taking excellent class of the person, you're putting so much of effort, I highly respect you. that doesn't hurt you.
Okay, I just have a doubt because already they are influenced by such words like bone to bone rubbing, like you have adhesive capsulitis. They are coming to us. How will we educate usually?
See, it again depends on the patient. You can educate like it's born a person. If you think like okay, I can speak, I can change the person mindset. If you feels like, then definitely you have to educate. But you feels like even though I'm educating a lot, but this person won't change his
Belief
mindset,
system is
means
very strong.
you have to go with the patient flow. Yes, you are having bone to bone contact. This like we can say but this is the best treatment to manage that. We can't change, we can't reverse, but we can manage.
So
We
in
have to
that,
agree.
so in that case, I can understand that one or two sessions are okay again. So in that case, I can understand that we need to give confidence by giving some exercises, strengthening their muscles so that their functional
Outcome will
outcome
be better, but
better.
the end the patient should not feel
Feel
like
like-
that. I can give one get its example. As soon as today I come to clinic, she was seeing one patient. That patient have a spondylolisthesis, grade 1 or grade 2 spondylolisthesis, grade 1 spondylolisthesis. The patient, we started itself, the patient very strongly said that the patient has pain itself. The patient strongly said that I have a spondylolisthesis. If that corrects, my pain is there in my life continuously with me. I don't have any problem.
My X-ray should say.
My X-ray should feels
should
like
be
my
normal.
fine is correct. That much negative belief system she has. We try to educate her so much, and I told her one thing. I understood she can't able to understand that. And in consultation end, I told one thing. Okay, but changing that spine alignment takes 6 months to 1 year. You have to do continuous effect. We will treat you to reduce the pain and improve the functionality first. Slowly you follow. We follow the session for 3 months, 2 months, 20 session, 20 plus session, and follow up and everything. Then we'll check up. Then she understands, she started treating. Today I'm coming and I'm asking. She said that she forgot the spondylolisthesis only because she don't have pain. She was very normal in her life. She was very comfortable because the pain is the ultimate factor. The pain, if you have, you go to any extreme to cure that. If you don't have pain, you don't know anything. The same principle you can apply to ACL patients also. For example, ACL patient will come with a grade 1 tear with doctor, someone suggested to do surgery. Again, I'm not blaming every doctor. The doctor who suggests surgery for grade 1 ACL tear. Okay. Suggested, and the person is going to do very afraid and worried and coming in front of us. I'm telling you don't need surgery. Then only one word I use. You have pain right now. Couldn't able to walk, couldn't able to run. What if you can do all the stuff without discomfort, pain, very confidently? Do you go for surgery? No. Let's do this. So pain is the ultimate factor. When you talk about the pain is multifactorial. What you perceive as a pain is a pain, right?
And also, even before taking the MRI, the pain will be very less only for them. After taking the MRI, and the doctor also will say that this much here is the problem explanation,
Even though
right?
MRI says MRI looks normal,
Yeah.
there's only edema, swelling present in the order, they feel very worried.
So after that, when you ask what is your pain range means, they'll say with a higher range.
MRI only.
Everyone expect that in impression it shows like
No significant changes.
abnormalities. Only they'll
MRI shows
believe like,
anatomy, man. So something, and most importantly, not only MRI or imaging, the word also. The patient come with the 3 out of 10 pain, your word is influenced to make them 7 out of 10 pain when you go out of the clinic.
Yes.
And your word also influenced to go out of the clinic better also. So how the language which you're using in the clinic also is a patient education is very, very important.
because if you are giving some treatment, they won't take it as a personal. They are giving this treatment only for me. No, here we are giving exercise as a treatment. So, and in some clinic they'll use modalities, cupping, dining. So they won't think like this treatment is especially for me. No, they won't think like that. But if you are talking to the patient, the words they'll take it as a personal.
Nice, nice.
So it matters actually. So than treatment, the patient education, interaction, that is actually a key.
Actually, in patient education, we should build that conversation that we can't get in one session or in the assessments, one day a consultation itself. So on treating them, we have to build that interaction so that that communication only make them to speak to us, open up many things.
The communication gives confidence. Confidence
Yes.
makes to improve beliefs. Belief system treat the patient.
Yes.
You don't need to treat. Yes,
it in turn improves the self-efficacy of the person.
Exactly.
So it will build the confidence, as you said, and the person won't feel the pain when they are doing the things they love. So
Exactly.
that will be the half treatment done.
Exactly. Still, our parents says, "Na, when I was child, this doctor was very good. If I go to see the doctor, itself,
pain
my
will go.
problem will go because of belief
Yeah,
that
exactly.
the doctor have some magic pills in the eyes to see and cure." No.
So and also whenever patient is maybe the pediatric one or a geriatric one, we have to educate not only the geriatric patient and pediatric one. We have to educate their family also. Okay, the family and family and who are they attached to that person. We have to educate to the then only the what are their rehab journey, right? So it should be in a complete way. So in healthcare professionals, we are the physiotherapists spending more time with the patients. So we have take that role. The patient education is very very important. So it's very very important as a if we are physiotherapists, we have to know. So it's not an easy job. So it's a skill. So when we treating more patients, then only we come to know what are the questions they arise and how we answer for that. Then only our knowledge about the condition and about the patient, different attitudes of patients, a lot of patients we seen. Then only
We can develop that quality. It
we
comes
can
with
develop
experience.
the skill.
Here I want to add one thing. She told we are spending more time to the patients, and again here I want to hurt some people who are following manual therapy and electrotherapy modalities and all, because if you are treating the patient with those passive modalities, you are applying the modality for half an hour, you won't come to the patient, you won't talk actually. Patient will sleep. Patient will sleep, or you are releasing the muscle, you are giving some manual therapy, they'll give some soothing effect, patient will sleep. So we are not actually talking to the patient because of these modalities on passive treatments and all.
Again, sorry guys, don't feel hurt. We are not blaming anyone. We are not superior to anyone. Just we are speaking what makes sense.
And here, if you are doing manual therapies also or electrotherapy modalities, at least talk to the patient, educate them.
So next, what I want to add is or ask is, pain education plays major role, right? For example, once we may felt that once one person comes to with one problem in our clinic, the same person comes second time, it's very easy. I
Easy
felt
to
this
treat.
easy, very easy to
Yeah.
treat. Why? Because patient education is not only educating about the condition and educating the patients about the pain signs too. Pain signs also you have to educate, and also importance of sleep and recovery, having a good water, food, fiber, protein. These are all the things also plays crucial role. These are things also you have to add in a patient education. You should not miss.
What I feel is most of us say we need to have a proper sleep, proper hydration, and proper food. Every patient says I'm already having that proper sleep and hydration. But how can we know that they are having a proper hydration or proper sleep? So we can ask them to initiate how many steps they are walking per day, then track how much liters they are drinking, and ask to report to us. So in that way, they really know how much they are drinking, then they can improve on it.
Exactly. That is also one of the important point of patient education.
When it comes to patient education, it's not like explaining the condition or do's and don'ts. No, pain education is very important, because if someone is pricking you with a pin, we'll feel more pain, right? More pain. But if you are, but they love to do tattooing. While tattooing also, they're doing the same thing, but they love to do tattooing. So in tattooing also the same mechanism happens, but they won't experience more pain, they'll enjoy the process because they know it will be painful, and they love to do it. So if they accept the pain, they won't perceive pain. So pain education is very important.
So these examples sometimes we can use. These kind of many examples are there. We can use to educate them.
Then in that case, we can also ask them what are the exercise they like, and we can give the preferable exercise.
Movements, maybe,
Movements,
rather exercise, what you
whatever
like to do.
movements. For example, some people like to gardening, so they can do gardening. Some people like outdoor walking. They can do outdoor walking to be physically active. So like this, they can incorporate movements which they like.
And we also talk about listening to the patient and what are the things we have to ask them. And already said that we should have open-ended questions. Like people come to us and they might not know what questions to ask us. They might, because of pain, they don't even know what they want actually. So we have to ask them that what you're trying to get from the treatment, what you're expecting from the treatment, what are the things you have to do going back from the treatment, what are the things you have to get back to, that we have to educate. And mostly people will come to us and say, I have to get rid of pain, that's the major goal for me. But that is because the pain is affecting their day to day life too much, that only pain is in their visibility, nothing else is beyond their vision. So we have to educate them there is a life outside of the pain. So that is our role to clear out the clouds and make them see something is beyond the pain.
For
It's still
example,
there.
I couldn't even walk. At least I can walk. If I have same pain, that's improvement.
Yeah, and we can reassure the patient that
Exactly.
not you are not only getting back to walking, you are going to jog, you are going to play with your children. That is what we have to tell them.
Exactly.
So
Exactly. And educating the patient, suddenly I remember this point. Usually, patients will ask, right? If I have pain during certain activity or too much too soon, should I avoid this activity? Should I avoid this activity? But what we do in our clinical practice, what I will say, if you take rest, you don't have pain, you only know, right? Why you are coming here? What if I am rehabilitating you? You am educating you. After 4 weeks, you are going and play. Again, the pain comes. Again, the pain comes. So, educating the patient to not doing anything or reduce doing, keep doing the stuff which you want to do. While rehab process, first week later, the same stuff is reducing the pain 20-30% is an improvement. End of the day, how much you improved is matter during that activity, because your goal is you're coming here with some discomfort for certain moves or certain position or certain activity. The end of the day, that activity should not aggravate the pain.
If the patient comes with pain, lot of pain, and we are also giving movements to reduce the pain, but it's also important to educate that you might have some kind of discomfort or pain, so don't limit the activities. It's fine to have some amount of pain. Okay, it's important to educate them. For example, even previously and all, when physiotherapists use manual therapy or any modalities or anything, dry needling, cupping, also they educate it. They might have a soreness, so it's important even after movements also they might have a pain, so that it's important to educate.
and also the patient will have doubts like, when can I start doing this, when can I go back to normal life. So we have to educate them. If it is appropriate, we can educate them like, you can do all the works you need to do, and until it is hurting you. So once it is hurting, no problem, come to us, it is manageable, it is under control, that we have to assure.
Words, or these are all the process which is happening during patient education.
Yeah, right.
So, if you are giving any treatment like exercise or any other treatments, each treatment have an effect, right? Therapeutic effect, physiological effect. It will be same for everyone. Maybe it is increase for somebody, it will decrease for somebody, but it is same. It's going to increase the blood supply, it will strengthen, improve mobility. Everything is same. But patient education, if you are giving some words to the patient or talking to the patient, that thing it's not same for all. Everyone interpret differently, so you have to personalize the words. It's not like you have to explain the condition, this is how you have to explain. If you, it is not patient education can't come from the learning. It is like experience, it's a highly skill of the therapist.
Additional skills to understand the patient perspective. It's very important. Everyone will not everyone will not have that character and attitude. For if you want to become a therapist, you have that skills, that's very very good,
And
or else develop the skill.
that is that is where empathy comes into role, compassion and empathy, seeing the world through patients eyes and walking in their shoes. Like we have to see how their world is, how they perceive the world, and how the pain is impacting their life, that we have to see.
So instead of learning some movement analysis skills, cupping skill, dry needling skill, and all. We have to learn these skills. Patient education skill, that is more plays a crucial
More
role.
than teaching rehabilitation and more than fine tuning the line, patient education is the number one treatment. Everyone has to improve. Most underrated skill also.
Most cost efficient.
Most cost efficient skill. Excellent. Most cost efficient. You know the expensive equipments for that to treat. Again, we are not blaming anyone who is using expensive machines to treat the patients. Okay, I think we come to end. So, if there is a therapist, a physiotherapist, what are all the skills they need and to improve the patient education? What is patient education? How it should looks like? Quickly, we'll finish with a summary or gathering points.
Therapist should be an active listener.
Therapist should be active,
Active
listener.
listener.
Then therapist must have a good communication skill.
Good communication skill, right? Listening and communication skill.
The confidence and body language of the therapist also plays an important role.
Exactly. Attentive listening. Attentive listening. Excellent. Confidence and body language.
We should respect their pain and we should respect whatever they say.
And,
Respecting the pain,
and as I mentioned earlier, empathy and compassion.
empathy and compassion.
That will
Excellent.
be very much helpful in understanding one's.
Exactly. Using appropriate languages. Additional skills to understand the perspective of someone who's sitting in front of you. Learning about the individual. It's a key factor. Again.
Then you must have some knowledge to educate the patient, like about the condition. So at least some
And, At
knowledge.
least we have some knowledge. Definitely
Yes.
we have studied and coming, but everyone will not have the confidence. What I say, what I add here. Don't worry if you don't have so much knowledge about the condition. Give some confidence. Be polite. Whatever you found out, explain to them. Go back and refer. Improve your knowledge. If you miss that, that's a problem. First day, if you don't know anything, that's very very normal and okay. We started a clinic like that. We treated the patient like that with a lot of concern. Sorry, slowly we improved. As you see 10 patients, your communication will improve, listening will improve, everything will improve. Don't feel worried. What I don't have these are all the skills. How can I improve? Where I can go? No. The process we can improve. Are you putting effort to improve? That's the matter. Any more points we should add?
And most importantly, I want to add a point. After the session, we need to ask the clients, do they have any doubts or questions to clarify? It's important to clarify their doubts and send them so that they have a better clarity while they.
After the consultation also, we should ask what you
Okay,
understand
that's-
from the consultation.
Exactly.
That is also very important. Excellent point of view. That helps you to rethink and reteach or re-language or use some appropriate ways to make them understand. Give confidence before they send going out. Some patient will very much confused after using so many things, language, speaking. They come with something, oh, the doctor is speaking so much, I think they know something. We'll come and that should not be an attitude when the patient leave your clinic. The patient attitude will be little bit confident and happy. Okay, I can come tomorrow. They will treat me well. Or else, if I have any doubts, I can ask them tomorrow. They will definitely help. That attitude you have to bring it.
And it serves as a reassurance for both the patient and the therapist.
Yes.
Hopefully this video was very useful and informative for all the physiotherapists right there. So if you have any doubts regarding this video, you can comment down. So we will just help you. Happy learning.